dear guests, my subject is about the universities of applied sciences and their role in innovation system. And I'm talking first in generally about the universities of applied sciences, and then our role in Finland, as well as how we in JAMK work in Central Finland and in the healthcare particularly. So, universities of applied sciences are placed in the innovation chain between the universities, research institutions and companies. So our research is, the main impact there is the applicability. This is very recent definition of research about by universities of applied sciences. So we are higher education institutions where the focus is especially on applied training and research. In Finland, all health professionals except physicians are educated in applied science universities. So nurses, midwives, physiotherapists. So it is applied professional orientation of the education. And what we do is practice-oriented research and development activities. So if we go deep, what does it mean? What is the research that universities of applied sciences do? First, they are always practical. So we always produce innovative solutions and concrete solutions to workplace. So it means practically that if I have a master student, so it's not enough that they produce new knowledge. So I always ask why, where it's going to implement it, what's the use of it. And we have always a three-party agreement with an employer or someone who wants to research, the student and the university, and then the student can start to work with the problem. So it is real life in all the research that the students even do. Secondly, it's demand-driven and targeted. So we always try to produce something that is demanded by the clients, by the patients, by the society, and help the changes in our society. Third issue is that it is collaborative and it is multidisciplinary. So even the government supports that some of the research funding, one of the assessment criteria is that it has to be multidisciplinary. So from same science background, the researchers cannot be from the same group or same university field. It has to be multidisciplinary. So they give extra points if you have engineers in it, or economists, or business people in the research setting. So when you apply for funding, it has to be multidisciplinary. And fourth, it has to be connected to the education. So it means that the results of the research has to be applicable in the education immediately. So not so that it takes like 3 years to publish the research, but you just put them into the education, you tie it up immediately to the disciplines you're teaching, the students. You talk about immediately of the research that you're doing. All lies back into this theoretical thinking and the writings of Gibbons, and in this time in Finland the universities of applied sciences were created and the former colleges were upgraded to be higher education institutions, and enormous effort was done to raise the colleges in order to be higher education institutions. The teachers were trained, the scientific training went out, And the requirements, for example, in Finland, to be a teacher in University of Applied Sciences, it means that you have to have master degree on your field, you have to have 3 years working experience, and you have to have a teacher education. So in the science university, you do not need a teacher degree. And you do not need the practice experience. But in applied university, you couldn't get even a position of a lecturer without having all these 3 elements. And that was the key in our society, this change. And what does it then? So if we put all these requirements, so as I told you, so in the mode 2, if we put it to universities of applied sciences, so there is always the context where the research has to be applied. So it has to be always transdisciplinarity, and there has to be this diversity. So diversity of the research group to have different kind of opinions, because always the innovations, they are created only if there is some discrepancy or different ideas, not with the people with same head setting. And how is it then assessed that the research is good? So we have to be responsible for the society, so for our clients, and it's evaluated through that it can be applied really, it's put into practice. So that means that it's applied science, which benefits the education. So the results of all what we do has to be used in our work. And the third one is the regional development. So we are tied up with our region, so the hospital, the population, the municipalities, the people of our region. So in Finland, at the moment, we have 26 universities of applied sciences. There used to be 32, but with the economical state of today, we are putting universities of applied sciences together, so the number is going down all the time. There is 140,000 students, approximately 20,000 bachelors graduating every year, 2,000 masters graduating every year, and our staff is about 10,000. And then there was the question of how to do research and raise money outside. So you can see here that at the moment we are there around 150 to 165 million per year that we raise money for doing the research and development work. So how did we do? So we started in 19th. So you can see here, Filippo was asking how to come from 0 point something to 15. I quickly counted, so in JAMK we have now 80.8% of our turnover coming for R&D outside money, so you can do it, I'm sure. It's doable, and you can see how it goes. So when we started, this is 4 years after the universities of applied sciences were launched. Not all were then 26 doing it, so some of them got the license later in 2000. So you can see how it goes up, what the role can be. And then you can see the personal. So there was this, so we have 10,000 staff members, 5,000 teachers, and about 4,000 doing R&D work. It's not so black and white. I'll come to that soon. So what we do, very little of basic research, extremely little, only 4%. Mainly these applied research and different kind of development projects. So that is our R&D. And where we get our funding, mainly from the European Union. So when you got this downwards, it was 2008 when there was the change. of the periods. Now we succeeded better. We have now managed to lead our universities over these gaps and to retain our research personnel and not to get these deep down. So now we learn from the previous time. So there are companies funding us, 10%, private companies. There is our innovation funding, national innovation funding, the municipalities, cities, and the ministries. So if we go then to Central Finland, so how does our regional innovation system look like? So we have there the universities, the knowledge providers, so there is universities, but not only the Central Finland universities work in that area, so we can consider all Finnish universities also giving their impact to our work. There are research institutions like National Institute for Health and Welfare, and Social Insurance Institution of Finland. And then there are these broker organizations like Center for Economic Development, Regional Council, and this Innovation Agency. And then the companies, we study very carefully what are the healthcare, social care organizations. We have lists of every single company in our region. We know the municipalities, their leaders. We have lists of the cities. We have associations of patient associations, civic associations. So we are very familiar and study very well the strategies and the needs of our working life. So at the moment, if we go back to our Pertti Malkki's faculty, so if we are in our staff with the 100 persons doing social and healthcare research, so we have ongoing now 33 different research projects. In JAMK, from teachers, 49% of teachers do R&D also. So only half of teachers do not work in R&D. So it is like a duty of we say modern teacher. So you cannot put research into the education if you're not doing research. If you do not do development work, you cannot train either. There was a discussion, also Filippo was saying that what were measured. Our government measures us not only through the years, how much we get outside, but also publications. So annually, in our school, we publish like 10 to 20 referred journal articles and about 25 to 50 in professional magazines or journals. So because we have this applied research approach, so we have to publish also for nurses, for other people, not only for science, but in order to develop our society. So I want to give you a small glimpse. So I put the title of the project, the target, and the partners. So one example of like each. So we have this kind of international R&D project concerning the international classification of functioning and disability and health, doing a mobile device applications. Or again, we do for the National Institute of Health and Welfare, for a national, so whole country is involved in this research, studying about the rehabilitation interventions quality. So, and then again, there is one mobile application to occupational health well-being in Central Finland area. And then there is about the health kiosk only in Jyväskylä area with the city, to developing independent low-threshold primary healthcare services and nurse-led clinics, very practical ones, or in rural areas, so how to develop citizen resuscitation skills and to have defibrillators in rural areas. So all kind of these projects and R&D works, all at the same time going on in the university. And then we are going in towards like the big ideas, and we're building and being a part of building the big welfare campus in the area. So there was a talk about the hospitals. So in Finland, the universities do not own hospitals, but it is written in the law that the universities and the hospitals have to collaborate. So it is a different mechanism of putting us to work together, and all our students of nurses or physicians to work in primary health care and hospitals. So we've solved that problem on a different way, and we are building now a futuristic new hospital with all the universities and the municipalities and the region together. And there will be a new campus with innovations and researchers, so we will be having an innovation campus together with all the parties in the future. So what we're going to continue here in Kazakhstan, so we're starting now the promotion of innovation capacity of higher education nursing in health services transition Pro-Inca project with all you. So there is Karakanda University, Nazarbayev University, Astana, Semey, and West Kazakhstan, and from Finland 2 universities. So we won in the capacity building project of almost €1 million. So we will work closely for the next 3 years in building up the innovation capacity of nurses. So in the project, the knowledge triangle and the change of healthcare system is what we share with European and with you. So this is the future of our collaboration. So we will in the future do 4 working package concerning the Center of Nursing in Excellence, and about the evidence-based nursing, the research in nursing, and leadership in nursing. So I'm sure we will be working a lot together with the innovations and with the nursing. Thank you.
Большое спасибо за доклад. Мы, наверное, тоже будем развиваться в этом направлении прикладных наук. У нас тоже много что можно сделать в этом направлении. Надеюсь, что все вместе поучаствуем в этом проекте Erasmus+, который возглавляет ЯМК по развитию сестринского дела. Сейчас у нас последняя презентация. Гриценко Павел. Электронный учебник «Новые технологии в образовании».